Should I just start speaking?
Yeah, you can start now.
Okay. Just tell me when to start. Okay. Hello. I'm Dr. Prasad Dandekar, a nephrologist working as an associate consultant with Fortis Hospital, Noida. So, today I'm going to talk to you about kidney health. Now, kidney disease is a growing menace day by day. This 10th of March, we celebrated World Kidney Day globally, and the theme for this World Kidney Day was Kidney Health for All. That means that I have to educate every one of you about how to keep your kidneys healthy so that we don't suffer from this kidney disease and its complications later on in our life. So let me take this opportunity to tell you on about some tips, some 8 tips to keep your kidneys healthy. Now, kidneys are a pair of bean-shaped organs located in the middle of your back on each side. Their primary job is to filter your blood and excrete the toxins via urine. But additionally, kidneys do a number of other jobs too, like maintaining acid base balance in your body, maintaining water balance of your body. They also stimulate production of blood, RBCs. They make RBCs in your blood. They also help in the formation of vitamin D so that your bones remain healthy. So, in short, kidneys perform a number of functions just to keep your body healthy. So, but the problem is that do we work enough to keep them healthy? So, today I'm going to share some tips on how to keep those kidneys healthy. These are 8 tips which will help to keep your kidneys healthy. Number one of them is stay active and stay fit. Now, I know it gets very little difficult to convince someone which you practice very little in your life. I know everyone has done convincing you, even given up on you, including your family, friends, doctors, dietitian, God forbid, even gym trainers. But science hasn't. There is good enough data to suggest that if you invest at least 20 to 30 minutes of your life on daily, on moderate to high intensity workouts, you will start seeing improvements overall in your metabolism, your blood pressure, and overall in your kidney health. Simple exercises like walking, running, swimming, cycling will take you miles ahead rather than procrastinating will. Second tip is control your blood pressure sugar. Now, day in, day out, majority of the kidney diseases that we see are related directly or indirectly to diabetes. What diabetes does that it starts leaking protein in your urine. Now, what this protein leakage do is that it starts affecting your kidney and overall progresses to a kidney failure. Now, data suggests that if you control your blood sugar in the initial part of diabetes, then you can prevent the occurrence of kidney disease in the future. If you are not a diabetic, it is a good idea to start checking your blood sugar annually via annual health checkup. Just do a fasting or postprandial blood sugar, and you will come to know about diabetes as soon as possible. If you are a diabetic, then consult your doctor and keep your blood sugars under control, aiming a target HbA1c of around 7. Now, third tip is control your blood pressure. Now, blood pressure and kidneys have a mutually destructive relationship with each other. They have a cause and effect relationship, meaning if you have a blood pressure for a long period of time, then sometimes you can have a kidney disease. If you have a kidney disease, then kidney disease can itself cause blood pressure. Now, if you are a patient of kidney disease, then keeping your blood pressure under control is the single most important factor which will help you in keeping your kidney disease away from progressing. A blood pressure of 120 by 80 millimeters of mercury is considered to be normal. As per the recent guidelines, a blood pressure more than 130 by 85 millimeters of mercury is considered to be a high blood pressure. We are seeing quite young individuals landing up with high blood pressure and its complications. They never had an annual checkup before and they eventually land up in the emergency with high blood pressure and its complications. And sometimes a kidney disease is detected. So it is never too early to start checking your blood pressure on a regular basis. Our fourth tip of this evening will be monitor weight and eat a healthy diet. Now, obesity is a numero uno criminal in causing or worsening kidney disease directly or indirectly. Thus, watching what you eat might help you in more ways than you can imagine. Avoid processed foods, control your carbs, eat a high fiber and adequate protein diet. Avoid extra salt in your diet via your masalas, peppers, because extra salt puts extra load on your kidney, also causes a rise in your blood pressure, and eventually causes kidney damage. Now, people who have recurrent stones should follow a particular type of diet in which there is very less amount of green leafy vegetables, less berries, and less chocolates. You should consult your doctor before you start with a particular type of diet. Our next tip of this evening is stay hydrated. Now, this advice is as cliche as anything can get, but still very less followed, especially for a country like us, which has a hot climate all throughout the year. So, drinking adequate amount of water throughout the day is of utmost importance. You can aim for drinking at least 1.5 to 2 liters of water per day, or roughly 7 to 8 glasses per day. Make it a habit. Drink more water, especially after you exercise, especially if you are suffering from something called as loose motions or diarrhea. If you are a kidney stone patient, then keeping yourself hydrated is of primary importance. Adequate water intake prevents acute kidney injuries, which have a long term impact on your kidney health. Our next step is stop smoking. So, if you are a smoker, then here is an additional disclaimer for you, something which they won't show you in media or movie theaters. Smoking also damages your kidneys in more ways you can imagine. Plus, there is an increased risk of cancer too. But the good news is that if you stop smoking, this risk will soon start reducing. So, it is never too early to kick the butt and stop smoking. Second last tip which I'm going to give you is avoid excess consumption of over-the-counter pills. Now, well, everyone tends to become a doctor sometime in his or her life, and who better than a pharmacist, fulfilling your every wish. But let me tell you that some of the drugs are sold under different brand names whose content even we may not be aware of. Many of the times we have to Google in our OPDs what the content of these some of these extravagant medicines are, and sometimes we discover that the patient is taking these painkillers which even he doesn't know of since a long time, and eventually he or she lands up with a kidney disease. Now, regular consumption of such medications will cause subtle insults to your kidney, which can cause kidney damage in long term. Fun fact: did you know that regular consumption of one type of anti acidity pill can cause chronic kidney disease in long term? Better consult your doctor rather than your friendly neighborhood pharmacist. Our last tip is regular health checkup. Now, I can't stress more upon this fact than any doctor can. What better investment than an annual health checkup with all the vital tests, including a kidney function test, to keep you and your kidneys healthy, especially in people who are at high risk of kidney disease. Now, who are these people? Patients who have hypertension, diabetes mellitus, cardiac disease, kidney stone disease, patients who are born or have a single kidney disease congenitally due to some reason, or they might have undergone an operation to remove one kidney due to some issues. Now, patients who have also suffered a kidney injuries at some point in their life, kidney injury, I mean, if they have suffered from any condition which has caused kidney injury in them, these patients are also at high risk of developing kidney disease sometime in their life. Now, these patients should undergo a regular health checkup on a regular basis because they are more prone to develop chronic kidney disease. Now, usually you should look for some warning signals which should tell you that you should immediately get a health checkup or a kidney checkup. These warning signals look like swelling over face or limbs, if you have excessive frothing in your urine, excessive any blood in your urine, either the blood is detected by yourself by your naked eye, or sometimes the blood is detected on a urine examination. If you develop hypertension, if it is a young onset hypertension, then it is always a good idea to call a nephrologist. So, I guess I have put enough light on this very important topic of kidney health. Share it with your friends, your family, educate them about kidney health. I wish you all a healthy life and much more healthier kidneys. Thank you. If anyone has any doubts, if you want to ask me, you can. Okay, so how to maintain your transplanted kidney? Okay, so uh, good question. Basically, pertaining to kidney health of a patient who has undergone a transplant. Now, the first and foremost important advice would be keep regular follow-ups with your nephrologist. Whoever who has done your transplant, the doctor knows your condition the best. About your transplanted kidney? Keep your regular follow-ups. That is first primary important. Second is again stay hydrated always. Third, any medication that you take, consult your nephrologist before that. Fourth, your transplant medications are of utmost importance. Never miss those transplant medications. In case if another specialty doctor asks you to change those medications or stop those medications, always ask your nephrologist first. And so, diet to keep your kidney healthy. Now, diet usually your kidneys in a healthy patient, usually there is no such diet which will aggravate or cause kidney disease. Okay, you basically have adequate fluid, adequate salt in your diet, no extra salt, and you are good to go. In case if you are having a kidney disease, then there are some dietary modifications depending upon the level of your creatinine, your GFR, depending upon your potassium levels. So in those patients, we advise dietary modifications. Apart from that, in a healthy patient, you have enough water, consume less amount of salt or adequate salt, and you are good to go. Any other doubt? Any other doubt? Should we stop? Okay, so I guess that's it. I wish you a very healthy life. Try to apply these tips in your daily life, and I guess you and me will never see each other because of a kidney disease. We will always, okay. So, thank you.